Hello, my name is Ralf Friedrichs. I'm an author, addiction recovery coach, a life coach, and the host of this show, the Take Your Life Back Today show. Folks, is Miami changing the way officials handle the opiate crisis? It's so severe down there. Well, last Monday, the Miami police announced a new plan to offer those with opiate addiction a chance to go to rehab instead of arresting them. By using a pair of federal grants totaling $1.6 million, the police department is working with local hospitals, including Jackson's Behavioral Health Hospital in South Florida Behavioral Health Network and the University of Miami Health System to develop a pre-arrest diversion program where those found with small amounts of opiates can enter a one-year outpatient treatment program. These programs would capitalize on the use of anti-addiction medications such as medication-assisted treatment programs, otherwise known as MAT, social services, mental health counseling, and general medical care. Treating the whole patient. The program has an expected opening date to start offering treatment around May 2019. Police and hospital officials are planning on spending the next 6 months hiring staff and working out details of the program. Dr. Patricia Ayers Romero, Chief Medical Officer of the Behavioral Health Hospital, reported to the Miami Herald that the program could treat around 100 people over a 3-year life of the grant. Much of the treatment will be outpatient, but the program will have some capacity for inpatient care. The ideal length of treatment is about 18 to 24 months, said Romero to the Herald, but the city chose a year to fit the parameters of the grants while offering a substantial amount of care to the patients. She said the diversion program will be a positive step towards tackling addiction in a way that will help people return to stable lifestyle. She described the range of services that will come with the anti-addiction medication as crucial to treating the whole patient. Medical professionals applauded the announcement at the Miami City Hall on Monday. Dr. Hansel Tooks, head of University of Miami, led the needle exchange, said the program is a necessary progressive approach to helping people who are suffering and cannot easily get treatment. Not only will it give addicts access to treatment at the point that they encounter law enforcement, but it will also have a broader public health impact across the whole community. In an epic move, Miami will move to pre-arrest diversion for individuals with opiate use disorder. Today, I am very proud to announce that Miami is one of the first to take this action. Is Miami changing the opiate crisis? While the new diversion program may come as a breath of fresh air, homeless people suffering from substance use disorder present a larger challenge for Miami police and public health officials. And this announcement of the program comes at a time when Miami's politicians have turned their focus to a group of homeless people living under the Dolphin Expressway in Overton. Additionally, just last week, the city conducted a mass cleaning of Overton where police and government bureaucrats showed up in hazmat suits to move the homeless into shelters or drug treatment centers. With increased complaints from Overton residents in neighboring apartment buildings, the city planned to clean up the sidewalks after a health official investigated new cases of HIV in the area, an inquiry that sparked fears of serious public health problems. Another issue is that these grants don't cover the cost of housing for homeless addicts and alcoholics. Arias Romero said she hopes to work with partner organizations such as Homeless Trust to make sure that there are beds available for those undergoing treatment. She also said that Jackson and the city are already looking for funding to extend the program beyond 3 years of granting, emphasizing the magnitude of the opiate problem within not just Florida, but our country. Florida as a whole, while Miami is just a small percentage of the population in Florida that's been hit by opiate crisis, Hillsborough County, which includes Tampa, and Pasco County, which includes Wesley Chapel, has been hit equally as hard. In September 2015, the Tampa Bay Times reported that heroin-related deaths in Hillsborough County, which includes Tampa, has increased by 700% from 2013 and 14, and we're in pace to increase by 100% by 2019. Folks, Florida ranked 4th in the United States for total opiate overdose deaths in 2017. The 3228 opiate-related deaths that happened in Florida in 2017, which represented 23% increase from 16, work out to an average of almost 9 opiate-related deaths every single day. In response, On May 3rd, 2017, Governor Rick Scott officially declared the opiate-related state of an emergency, and Surgeon General Celeste Phillip declared the opiate abuse was a public health emergency. The same day, the Florida Senate approved a bill that would create more stringent penalties for individuals who illegally sell synthetic drugs such as the powerful opiate fentanyl. As Miami officials announced the new diversion program, we can only hope that the rest of the state will follow. I mean, let's talk about a Sober Nation. Sober Nation strives to give the suffering addict all the resources they need to get sober and to support recovering addict along their path. And I was fortunate enough to make their 2 different magazines. Call me at 844-405-HELP. We can help each other take our lives back. Be good to yourselves. Be good to each other. A simple smile can go a long way to a total stranger. It can even change your life. May God bless you, and may God bless America. And remember, Sober Nation magazine. It's a great magazine if you have an addiction. And remember, God will help you. Just reach out and ask Him to guide and direct you. May God bless you. Take good care of yourself.